patient's name is Matthias Hedding. He's a 62-year-old male who came in yesterday through the emergency room with a complaint of sores on his heels. He doesn't live in the area. He's here visiting a cousin and will only be here for 2 weeks. He has a history of diabetes, type 2, and heart failure. He just got to the floor from the PACU where they did a wound debridement on his right toe and heel. He does have some swelling to that calf area. He's got an IV of half normal saline running at 100 an hour.
Where is it?
In his right AC, I believe, but I'm not sure exactly where it is. It's right side, but I don't know.
This is our patient?
Uh-huh.
It's his right hand?
Is it hand?
Yeah. Oh, never mind, it's there. It's AB. I think, right? Yeah, AB.
Okay. He had a blood sugar done at 11:30 today. It was 170. His next one will be due before dinner time. He is on oral replacement at home. He's single and has no children. He's kind of anxious prior to the surgery. He had an elevated white blood count and an elevated hemoglobin A1C yesterday on admission.
Anything back on any other labs done on those?
No.
Since then? Okay.
His vitals in the PACU were blood pressure was 142/94, heart rate was 92, respiratory rate was 22, temp was 97.2, and his O2 sat was 94% on 2 liters.
Does he still have his cannula?
Mm-hmm.
Okay.
He has an allergy to iodine, and he has a full code. Any other questions?
GIGU?
He's hasn't voided since he's gotten back from surgery. He just got back.
Catheter?
Nope.
Okay. Diet?
He's going to be on an ADA.
Okie dokie.
Any other questions? All good? Okay.
Thank you.
You're welcome.
You'll be in there answering for him? Okay. Do you want to get vitals?
Yeah.
Is he breathing? He's not.
I think maybe she's gonna set it up back there.
Because he's not stimulated, right?
He's what?
He's not
Okay,
stimulated.
38 times, there is a delay with your voice, so you need to pause a little bit when you're asking questions.
Okay. And vitals, are you giving those to us, or can we get them, or?
We get them off the monitor.
Okay.
Let me see where. Oh, I don't know where she's at.
Which one?
My assessment for him. It's okay, no worries.
You're good?
Yeah,
Okay. Ready?
ready.
Okay. Hello, how are you doing today, Matthias?
My foot really, really hurts.
Your foot really, really hurts? Okay, well, we're here to help you with that today. My name's Brianna. I'm a nurse. And this is John. He'll be here today, too. He's another nurse, so we'll be here helping you out, okay?
Okay.
Okay. Do you have any allergies?
I do. I'm allergic to that orange stuff, that iodine.
Iodine. Okay. And then can you please state your first and last name for me, please?
My name is Matthias Hedding, and I was born August 14th. I'm 62 years old.
Perfect. Okay. So we're gonna get you sat up here in bed really quick. Is this running for him?
Yeah,
Two
it's
liters?
going. That's
Perfect,
what it
okay.
meters.
We're gonna sit you up. Can you do it on your side?
Okay.
Yeah.
How's your pain level today? Keep going. Matthias,
Okay, that's
Matthias, how's your pain level today?
Listen to him.
my foot really, really hurts.
Your foot really, really hurts? Okay. If you were to rate your pain on a scale of 0 to 10, 0 being the least amount of pain and 10 being the worst possible, what is your pain level?
Oh man, it's 11. It really hurts.
It's an 11.
Okay.
Okay, so we'll get you some medicine for that. Do you remember the last time you had some medicine for your foot pain?
You know, I don't remember. I just came out of surgery and it really hurt. And I told the other nurse that it didn't do anything.
Okay, so we'll get you some medicine right now. John's gonna go take a look at that, okay? And while he's doing that, I'm just gonna do an assessment for you. I'm just gonna check some things out for you. So you said you just got back from surgery. Can you tell me why you were at surgery?
Oh, wait, be careful, be careful. It really
Oh.
hurts.
I'm so sorry. I just need to lift this sheet up, okay? All right. So, can you,
Leave the sheet off because I don't like it rubbing on the pillow. It hurts.
what was that?
Leave the sheet off.
Oh, leave the sheet off. Okay.
Leave the sheet off, yes, please.
Okay.
What's the pillow under the calf so we can raise the heel off the bed?
Great. I'll grab. We don't have a pillow for him. We do. Okay. So, can you tell me why you went to surgery?
Oh, I have this sore on my foot that really hurts.
And how did you get that sore?
You know, I don't know. I may have stubbed my toe or something. It just got bigger and bigger.
Okay. How about if I lift your leg up here, we want to put this pillow underneath your foot.
Oh, but it really hurts.
Okay. Let's actually get some medicine for you first, and then we'll put the pillow, okay? Before we do any of that. I'll leave your foot uncovered. Your dressings look good. They look nice and dry, so that's good. And no drainage. Do you have any, probably a little bit of tenderness here to the touch? And some pain.
It hurts all over. Don't touch. Oh.
Okay. And I see you have a little bit of swelling here on your ankle. So I'll leave this like this. John's gonna get you some medicine right now, okay? He's checking our your medication record, okay? While he's doing that, I'm going to have you follow my finger for me here. Good.
Okay.
Good, okay. And can you open your mouth for me? Okay, say ah. Okay, good. And can you cough? Good, thank you.
I'm gonna act like this is working.
Okay. All right, so I'm just going to listen to your lungs for a moment. Just go ahead and breathe normally for me. And every time I move my stethoscope, you can take a nice big deep breath, all right? Let's go down here a little bit. Okay, thank you. Now I'm going to listen to your heart, so you can just breathe normally for me, okay? Great, thank you. Okay, so I'm taking your vitals. I can see your heart rate's 90. Pulse ox, that's supposed to be on, correct?
Yeah, it's on.
Okay.
It's on.
And let's see. His respirations are not on there.
He does. I don't see his pulse either. You just had to like take it like manually, I guess, because I don't see it on there. All right, Mr. Hedding, I'm John. I have your medication for your pain. Okay.
Okay, what's your medication?
We're gonna give you morphine.
That'll help with the
It's
pain in
gonna
your
help.
feet.
No, I'm not sure if I want morphine. I had a friend that took morphine and became addicted.
Okay, well we're gonna keep control of this so you don't get addicted. We're not gonna give you too much. This is only gonna be as needed. But right now, since your pain's at 11 out of 10, this is gonna help you the most with your pain control.
Your doctor also has an order in there for you at a prescribed rate.
Okay.
The doctor has an order in there for you at a prescribed rate, so he's not going to give you too much. He's just going to give you what he thinks you need so we can get your pain under control from your surgical wounds on your heel and on your toe there.
Is this supposed to be going?
Yes, at 100 mils.
Okay, as long as I don't become an addict.
As long as you don't what?
Become an addict.
Okay, yeah, we'll do everything to make sure that you don't. Okay, this is just here to help you with your pain right now because we know it's so high. Okay, I'll be right back. I'm going to write down some information over here.
Check the probe for his finger. That would probably be the deal. She's got in the pulse.
It is what?
What did you say?
Could you say that one more time, Mr. Hedding?
Actually, if you check the probe on his finger, the O2 stat and pulse would probably come up on the monitor.
Check his, yes, too.
Check it on
Sorry, Mr. Hedding, we're just trying to make this equipment work correctly here.
that. All right, Mr. Hedding. Can I get your full name and your date of birth, please?
My name is Matthias Hedding. My date of birth is August 14th. I'm 62.
It's running. It's good.
It wasn't.
Did it stop?
Pumping rate, it's running now. Yep, okay. So say his respirations are at 19.
I'm not sure when work's not working. His O2 stat is 96%.
Okay.
Pulse rate is 90.
Pulse rate is 90. So I'll be sure to document that his respirations are 19 before we give him that morphine.
Okay.
Once John gives this to you, Mr. Hedding, I think that your pain will definitely be better controlled. And we'll come back after he gives it to you to check what your pain is again so we can make sure to keep an eye on that, okay?
Okay, how long is this going to take?
How long is it going to take to work? Just a few minutes. He's going to put this in your IV, so the medication is going to get into your system pretty quickly, okay?
Okay, thank you.
You're welcome. Is there anything else that we can do for you right now? I know John's going to finish doing this.
No, I just need to get that pain medicine. My foot hurts so bad.
Absolutely. Okay. He's working on it right now, so we'll get there for you. So why do you think that this happened? Because you stepped on something, and then I read that you didn't realize that you had that wound in your big
I'm just
toe
gonna clean this off.
until just a couple of days ago.
Yeah, I don't go around barefoot very often. I kind of wear socks all the time.
Okay. Well, were you maybe going around barefoot somewhere and you didn't realize? Because you have a history of diabetes, and that's probably, why you maybe won't be able to feel on your feet and things like that.
No, I think I stubbed my toe. I was going out to get the newspaper outside, and I didn't have my shoes on, just my socks.
Okay. Well, maybe next time we're going to have to get you all healed up here, but after that, maybe next time you can be sure to wear shoes outside so that this doesn't happen again.
Even slippers in the house.
What's that?
You also want to make sure that you're wearing
Okay.
slippers even around the house.
Yeah, like John said, shoes outside and some kind of shoes inside, because sometimes we can drop things on the floor, and since you don't have very good sensation in your feet here, you might not be able to feel it, and we don't want this to happen to you again, okay? Okay, so
Careful.
John's going to give you that medicine.
So I'm giving it to you right now. This is morphine, so I have to give it to you over an allotted amount of time. So it should just be about 4 minutes or so. We'll keep talking to you, pushing this into your IV.
Okay, you can just slam it in there. I hurt so bad.
John can't do that because the medicine works best for you if we give it over the recommended time. So we can't do that for you, but the way that he's giving it right now, that's proven to be the best way for you. So we'll make sure to do that, and hopefully very soon your pain will be decreased. So what kind of things are you eating at home? What's your regular diet like at home?
Well, I don't eat a whole lot of sugar, but I do eat out of the fast food restaurant quite a bit because, I live by myself.
Okay, so eating fast food, that's not good for your food intake, especially if you have diabetes. So can you think of any other alternatives? I know you said you live at home. Any other alternatives, maybe like meal prepping? Do you think that you could do some meal prepping at home, and that way you wouldn't have to eat out and eat that high-fat food from those fast food restaurants?
I don't cook very well.
You don't cook very well? Okay. Have you ever heard of Meals on Wheels?
You mean the roach coach?
It's kind of like a roach coach, but they have kind of healthier food. So there's a program, and depending on kind of your insurances and things like that, there's a program called Meals on Wheels where they prepare meals for you and they can bring them to you. So they'd be much healthier alternatives than just driving through that fast food restaurant every night, on your way home. You could call and schedule times with them so they can bring you meals, and their meals are much, much healthier. So that would really help with control of your diabetes.
Okay, have you heard anything about the new senior center in town? I saw that, and I thought maybe there was one where I live. They have lunches every day.
That's true. That's absolutely true. I haven't heard anything much about the new one in town, but we can definitely schedule something like home health, or have your case manager look into some kind of options for you where you live, to see if there's a senior center, and I'm sure there is, and that would be a great thing for you to go and partake in. That would be really good. You can have some socializing activity.
Maybe I can find me a lady friend there.
Maybe you can. There's a lot of people who go and have fun times at the senior center.
All right.
I don't want them both bigger.
Well, hopefully that won't happen, and you'll be able to find a really nice lady there. Okay, so John just gave you all your morphine there. Your pain should be subsiding here pretty quickly. Tune's on, that's running again. Is there anything else we can get for you? Your call light's right here.
We check all vital signs, pedal pulses, leg extremities.
I would not check his pedal pulses.
I can do that if you want me to.
Okay. How do you feel about putting this pillow under your foot now?
My medicine works pretty quick.
It does. I'm going to pop this under your heel just to make some elevation. How does that feel? Does that feel okay?
Yeah, feels all right.
Okay. I can't feel his pedal pulse, but we're just checking your pulses here on your feet to make sure that you're getting.
Don't push too hard.
Okay, we'll be gentle. Let's say 2+.
Let's say 2+. I can't feel that.
No, there isn't one. 2+.
Oh,
Okay. All right, we're all scanned in. Okay, Mr. Hedding, is there anything else that we can get for you right now? Oh, yes.
No, I'm getting kind of sleepy.
Okay. before we leave, I know we just gave you this medicine, but this thing that John has right here, that's called an incentive spirometer, or an IS. And we'll come back in a little bit and check on you. But when we come back, we're going to do some teaching. We're going to teach you how to use that, okay? Since you just got done with surgery.
Okay.
Okay, it'll help with your lungs. It'll help with your lungs. It'll prevent you from getting pneumonia or atelectasis, which is a condition that happens in your lungs after surgery. So when you use this, you just blow into it. He can show you now if you're not too tired. Or inhale, I'm sorry.
Yeah. Alright, so what you're going to want to do is you'll put this in your mouth.
I'm tired.
Okay.
We'll come back and show you. But the general principle is that you put your mouth around the tube, you inhale, and it flutters this little chamber right here. So it's really good for helping prevent pneumonia after surgery, okay?
Okay, it sounds pretty important. Dawn, if you want to show it to me, you can.
Okay.
So what you're going to want to do, Mr. Hedding, is you're going to put this piece in your mouth, and you're going to take a deep breath in as hard as you can. And like Brenna said, it's going to cause this bubble to raise, and you're going to try to hold it as long as you can at what we have you right now at 2,000. You're going to try to hold it as long as you can at 2,000.
And every time you take a breath, see this little chamber right here? It says good, better, and best. I know you don't have your glasses on right now and you use glasses. We'll get those for you. But you want to keep this little yellow piece right where it says best and hold it there as long as you can. And then when you can do that, each time you'll improve and improve. And we want to practice this probably about 10 times an hour, spaced out through that hour. So you can't do it just 10 times in a row, but you'll want to do it 10 times throughout that hour, okay?
Okay.
You want to give it a try really quick before you go to sleep? Sorry.
We can also turn his head and cough too.
Okay. All right. Well, we'll let you sleep. Would you like to be laid down? Or are you comfortable where you
I'm
are?
actually going to recliner chair at home.
Okay, great. So we'll keep you there right there where you are. Here's your call light, Mr. Hedding. If you need anything, please let us know, and we will be back to check on you in a little while, okay?
Okay, sounds good.
Okay. Bye-bye.
Okay, we'll call it there, guys.
Okay, thank you. Good job on your medicine.
Huh?
Good job on your medicine.
No, you did everything.
No.
It's weird.